November is National Diabetes Awareness Month, and here at WMAR, we want to make sure that you know all the ins and outs of the disease and how it can affect different parts of your body. That's why we sat down with Dr. Catherine Duncan, an ophthalmologist for GBMC.
So, diabetes is a disease that affects the very small blood vessels in our body. And so it likes to affect the kidneys and the brain, but the eye is definitely a place where we have these very small blood vessels. And it damages those vessels in a way that prevents them from bringing oxygen to the eye. And that causes problems like bleeding in the eye and swelling. And these things can cause, unfortunately, permanent vision loss if they're not treated.
Dr. Duncan says there are a couple things you can do to better your eye health if you're on the verge of diabetes.
So really the best thing you can possibly do is, control your blood sugars. If you're right on the edge of having diabetes, diet, exercise, all those things your primary care doctor tells you to do are good for your eyes too, because the lower the blood sugars, the less likely, you're going to develop these eye problems. Um, you know, if patients ask, eye health in general, what's good for your eyes, we tend to tell them when you're outside, it's a good idea to wear sunglasses, eat a healthy diet. But aside from that, nothing else that we would really recommend.